we're rolling there. Okay, welcome to Pulp Nonfiction, and today we have with us the esteemed Gavin Convey from Washington State. But you might tell from his accent he didn't grow up in Washington State. He came about there through a bit of a convoluted route. You're a general dentist. You got your dental degree in Ireland. Worked a little bit in the UK, and then went back to Ireland. Did a fellowship in the hospital system there. Hospital residency was part of the fellowship, and then hopscotch between Ireland and Australia a little bit. Got the endo bug. Went to Texas. That's where we met. You ended up spending 10 years in Texas, and you thought, wait a minute, I want to see some snow and mountains, and moved to Washington State. And you've been there 3 years. Is that right?
That's a pretty good synopsis, Joel. Yeah.
There we go. Well, take it from there. Tell us a little bit more about yourself. I just kind of hit the geographical points.
Yeah.
Hello. So I feel like I'm on the BBC. We have kids walking behind us.
I should go out. Sorry. Go on. Sorry.
We're going to be world famous now.
I know.
That's...
Sorry, actually. I'll be out in a while. Sorry, yeah. I'm sorry about that, Joe.
No worries.
Yeah, I was a general dentist for about 6.5 years.
Yeah.
And my last stint for 2.5 years was in northern Queensland in a city called Cairns, and we were located in a beautiful little city. Our nearest endodontist was, I think, about 1,000 kilometers from us. So that was what sort of gave the drive or the need, if you will, to at least try to improve my endodontic skill set. Mm-hmm. So I attended a few courses, and as you sort of put it, got the bug. Really enjoyed being able to fill my daily hours with endo and a lot of wisdom teeth. So it was endo that won out, and yeah, the rest is history. I decided to apply for a number of programs in the States, everywhere from UW, go Huskies, all the way down to Fort Lauderdale, Nova down in Fort Lauderdale. So, and everything in lots in between. And I guess it was by happenstance I ticked the box for Baylor on the application, and that's where we sort of ran into each other back in 07, 08, I suppose, when you finished.
Yeah.
And yeah, and then
you cleaned up all the messes I left behind. Dr. Perf was my nickname, right?
Yeah, but yeah, that was a fun residency, a little over 2 years, and then I had the fortune to have a job offered to me by a great endodontist in the Dallas area, and Texas left the door ajar and allowed this Irish fella in, and I was worked there for 10 years, and or 7 years after residency, and then we made the call to move here to build a business, and as you rightly put, just to expand our horizons. We have 2 young kids. We thought this would be a great place for them to grow up, and it is.
What's the name of your practice again?
Yeah, Lake Washington.
That's right.
So Lake Washington, as we didn't know anything really about the geography. Lake Washington, the lake that sort of divides Seattle from Bellevue. So there's Lake Washington School District and all sorts of things, and we were trying to come up with a name, and that seemed to be untaken. All the other clever combos were already taken.
Yeah.
So that was what we chose.
Oh, excellent. Okay, well,
Lake Washington, and check us out.
Yes.
Smash that like button.
Yeah, if you're sleepless in Seattle, you're the guy, right?
That's it.
Yeah. So let's chat about the elephant in the room, COVID, and how is it impacting the great state of Washington? And
well, we were sort of the first, I guess, the first target, or the first at least known target. We had the first case in the U.S. here in Snohomish County. It was a gentleman who I believe was had visited Hubei province, or perhaps Wuhan. I can't remember the exact details. But he was, that was, I think, I want to say early January. may not have the details, but yeah, he fully recovered, but that was one case, and the state of Washington had sort of created. I remember hearing on the radio that they had created quarantine areas near, in a sort of near a small town out in the mountains, with the anticipated thing that we'll never need to use these, but they're going to be here. It's for people who weren't able to self quarantine in the highly unlikely event that there was a COVID-19 outbreak here in our locale. So it's sort of sticks in my mind now. Recalling that little radio spot on NPR. How quaint it seems now with all that's going on in the world.
Yeah, what seems crazy and overly pessimistic a week or two ago seems spot on nowadays. Dealing with a little bit of a bigger virus, I see.
Yeah, I know.
Some of them take swatting.
A bigger stick.
So, and now things have progressed. Are you limited in Washington State to treating emergency patients?
Yes, Governor Inslee, approximately 2 or 3 weeks ago, sort of did an executive order restricting the practice of dentistry to only emergency dental procedures. And that definition of what constitutes an emergency. There was some guidelines from the ADA, and essentially it confines it to pain and or infection, or combination of the two. But it leaves it open to interpretation for the clinician as to determine what constitutes an emergency.
Right.
So, for example, an orthodontic patient that really needs to get their brackets off isn't an emergency, but one that breaks a wire and that's cutting their gum, they'd be able to get in and be seen. For endo, I guess a good chunk of our patients are emergent or soon to be emergent without treatment.
Mm-hmm.
Not all of them, and obviously there's chronic cases with lesions that are asymptomatic for weeks, months, years that wouldn't constitute an emergency. And then there's others like irreversible pulpitis where it's gone from no pain to stratospheric pain in a matter of hours because of perhaps a recent deep filling or crown or something along those lines, or a crack in the tooth. So it's very hard to, I think, argue against seeing a patient with an irreversible pulpitis. Granted, their life is not in danger because there's not any infection involved. So there's not any concern about compromising, say, fascial spaces, or their airway being compromised as a result of this severe pain they're in. However, I think the other very important factor we as healthcare providers have to consider is if we're not seeing these patients in pain, where are they going to be seen? And with all the dental offices closed or on a skeleton crew, there's only one place that they can go, and that's urgent care centers or emergency rooms, where they'll be seen by physicians, nurses who have far better things to be addressing at the best of times, but particularly now when resources are so well publicized that they're so stretched. I think the onus is on us as providers to do what we can to help, and relieve the burden there elsewhere. So I think there's those two things to consider.
Yeah, keeping the patients out of the hospital. Yeah, because we don't want to burden the hospital, and preventing the patient from a stitch in time saves time. Treating something before it gets out of hand. So that brings up the question, because I've come across it myself, is we're encouraged strongly, in the strongest possible terms, just shy of it being demanded, that we medicate, do teledentistry over the phone, and they've relaxed the rules. You don't have to do a clinical exam and send them
Yeah.
drugs. But the trouble is, are they screaming towards that cliff edge anyway? And should we jump in? And when do we jump in? And chatting with you, it's a bit of a different perspective, because up here in BC, I just had a conversation with a few patients, and they're on antibiotics, and it's like, well, give it 3 days to kick in, and if it is working, then that's bought you several weeks, and maybe the world's going to be a little bit safer in a few weeks' time. And maybe not. And our take here is, if the patient is negotiating with you about their pain, like, well, I'm really concerned how I'm going to be next week. That's not a dental emergency. Because true dental emergency is, it's today. I don't know if I can sleep tonight. I mean, that's the dental, like, what do I do? And so it was pretty clear. But then in the back of my mind, I'm thinking, well, am I just kicking the can down the road? And maybe in a couple of weeks, the world won't be cleaner, and right now my schedule's open. Maybe I do go in there and treat them and capture that right now. As dirty as the outside world is with a virus, it might be dirtier next week, and we know this is going to need it at some point. But before, I was sitting quite comfortably, like, we're playing the long game, kick the can down the road. And after chatting with you before we turned on the recorder, it makes me think, well, hang on a minute, maybe jump on it now, not too aggressively. I'm not saying everyone should be doing root canals left, right, and center, but whoa, wait a minute. It's we know it needs it, and we know it's headed that way. What do we do? And what are your thoughts? I mean, because you're treating more patients, and I believe that's kind of more in line with your thoughts.
I agree. I mean, I treated 2 patients today. The first was a similar situation that you described. This gentleman just, fractured a lingual cusp on a lower premolar, and he's exposed the pulp. So that's something, and he had a lot of pain, and then it eased off a bit. So what do we do? Do we say, well, just grin and bear it and let that pulp be exposed to the oral cavity for X number of weeks until? I mean, I honestly, just looking at the way the numbers of cases are growing around the country here, I'm not overly familiar with how they are in BC, but here in Washington, it's not going to be better in a week or 2 weeks. It just won't be.
Yeah.
So we're left with the choice. Do we ask an individual to suffer, or do we can do something that's I believe is relatively not hugely invasive? We do a root canal. We're not we're not putting, I think, the patient or ourselves or our staff at undue risk by doing that. We're providing a required service to alleviate an individual's suffering, because he's going to need to be that suffering will need to be alleviated somewhere. Could he have waited a week? Could we have said, here's some antibiotics and maybe it'd be better in a few days? With a pulpitis, I don't believe so. Or until that pulp dies, it's going to be going through its death row.
Yeah.
And then the second individual was a much more urgent concern. That it turned out the tooth was not savable. It was a split tooth. But again, we weren't able to make that determination until we were in there. So we're doing a procedure. We're removing the necrotic tissue, and we ended up medicating it to reduce the bacterial load and her risk of infection. Then we've also started our own, a course of amoxicillin with a bolus dose given in the office. So we're really trying to cover all our bases there until she can get in to see, the oral surgeon. So hopefully we put her from an emergent position to a non-emergent one, from doing what we did here today, and her life will be made easier as a result. And because she was in her 70s, so she doesn't want to be out and about more than anyone else does, at least in that age bracket. So again, it's sort of we're in terms of triaging people, we're triaging them when we see them. Teledentistry, I think it's a laudable goal, but I think it's not very practical for dentists, or at least for in the endodontic field, because without really examining things thoroughly, I mean, you can do a frank examination. Okay, there's no major swelling, and you don't have any trismus, and You can determine if somebody's afebrile or not. But you can't. I mean, pain is so subjective. How do we if tell some person with the same, the same problem might have subjective symptoms that to them are stopping their life.
Mm.
Someone else might be able to grin it, bear it for longer. So pain is a very subjective thing, and I think it's very hard to pigeonhole people based on that and say, well, you couldn't have treatment because you're the greasy wheel, or you're the
Squeaky
wheel that gets the oil.
Yeah.
So we don't want to.
We're the greasy mechanics.
Yeah. Yeah, that's it. So, like I said, maybe some would argue that that's somewhat cavalier or a flippant attitude to what constitutes a dental emergency, but I don't believe it does. I think with endo, no one's coming skipping a merry jig through our office doors at the best of times, and pain is pain. It's just,
and you so rarely do afterwards as well, which is amazing. Neither in nor out.
I know. Even if I turn the old jig music on.
Culturally, just out to lunch. They don't get it. Well, one of the things is, and you haven't had happen to you in Washington State, is we had the Pacific Dental Conference in British Columbia, and that's become a real political issue, and it's in the news all the time. So we actually have a patient population. The average British Columbian does not want to come in the dental office because the dentists have been tagged as high risk, and we had to every dentist in British Columbia pretty much had to self-isolate for 2 weeks.
If they had attended the conference, or regardless.
Yeah. Well, if they had attended the conference, yes, but the conference has 15,000 people. We don't have 15,000 people in BC. Most of the dental offices go, so they basically just did a broad brush, like any dentist who went to PDC should self-isolate. Well, That's what you're getting questioned. Did you go to the conference? Did you go to the conference? Did you go to the conference? So a lot of dentists are like, it's just not worth it. So anyway, but the culture's out there. Everyone's, and we had some dentists from other parts of Canada who came to the conference and then took it back to their home provinces. Mm-hmm. So it's a completely different, like I find no problem at all having the patients go on the meds and not come in, which back in the old days, 3 weeks ago, would have been a different story, Yeah. Oh, yeah.
Sorry, Joe.
That's all right. No worries. You got a little toothache. Did you want to come in and say hi? Hello. How are you? It's the skiers. You guys look different without your helmets. Did you guys like Whistler? Who's the fastest skier?
Daddy.
I don't think that vote was unanimous. I think there's someone who's not voting for Dad. Yeah.
Please.
Bye, guys.
Just close the door, will you?
No, you trip the underline, but not the
Okay. Can you close the door, please?
I'm cooking rice halfway.
Can I take 1 minute to?
Oh, absolutely. No worries. I'll hit pause. Yeah, for sure.
Okay. Yeah. Sorry.
Yeah. All right, it's back recording again. So that's the situation in BC. It's quite unique because back in the old days, which is like 3-4 weeks ago, patients would get, they're well-serviced consumers. So they be a bit upset, a bit narked, like, what? I can't come in? You can't treat me? And now they're like, yeah, no problem. I'll take the meds. I totally get it. And I'll let you know when it goes from bad to worse. And then ethically in the back of your mind, you're thinking, well, I kind of know what's going there anyway. Yeah. How bad do I have to leave it? And am I just really like having these people stand in the middle of the road with their eyes closed, waiting to get hit? And then it's like, okay, now I can see you. Like, I'm the paramedic, but till that leg's broken, you're on your own. Or you use the good analogy of the person with the chest pain. When does a cardiologist go in? Well, it's a mild pain, but I'm a specialist and I treat big pain. And in some regards, we're in a big situation and we don't want to be doing things frivolously. It's a tough.
Exactly. And there may well be situations where maybe physicians are encountering situations like that, but not being in that field, of course, I couldn't speak to that. I don't know how.
Yeah. So do you have special instructions for your patients coming in to see you and then leaving?
We're asking, of course, any, you can't go if any recent, respiratory illness or things like that, and if there's any question, of course, no, we typically wouldn't be seeing them, but that situation hasn't arisen. Initially, when this was kicking off, we had the, not health and safety posters, but for want of a better term, health and safety posters suggesting that you screen patients. Have they been to China recently, or have they been to, wherever it is? But as of course, the list of locations where, the virus was endemic became more and more, it became a rather redundant question, particularly here in the state of Washington. We are the Hubei province, or we're the Hubei province of the United States.
Mm-hmm.
So I had a patient yesterday on the phone, and he asked me, was it okay for him to come in wearing a mask? And I said, absolutely, you can do that.
Mm-hmm.
If you're out and about, it's not related to, you're not coughing and sneezing, or nope, it's just for things.
He's a big Batman fan.
But yeah, so we have sanitizer. We have, of course, hand sanitizer readily available for all patients as they walk in. We're screening all our patients and staff for, checking their temperature with a non-contact thermometer. Again, a patient with a fever walking into a dental office, I cannot recall a situation where that has ever arisen, even during good times.
Mm-hmm.
But it's one more tool that we're using to again try to at least do our part to screen people. I mean, if it's good enough for the metro or restaurants or wherever in Taiwan, they're screening people everywhere, all across the city. You could take a trip and you'd be screened maybe 4 or 5 times. Mm-hmm. It's not an onerous thing to subject people to. When we started doing it, I'd ask every patient how they felt about it. Were they comfortable with doing that? Did they feel it was sort of invading their privacy? And not every patient was actually very pleased that we were doing it. Was glad to see that. So that was good to know. And then in addition to, of course, universal precautions, which should be universal regardless of somebody's health condition, regardless of the time of day or the month of the year. We're taking additional measures in our own office to clean contact points, armrests, switches,
mm-hmm.
everything we could think of in the downtime, and there's plenty of that. And that's on top of the owner of the building doing additional things too. But we've got to be our own our own advocate in those regards. So again, trying to do everything we can to lower the the microbial load on any surface, be it something innocent or something pathogenic.
Yeah. Well, we now give our patients instructions. We want them to come straight from the house to the office, no detours. We have no chairs in our waiting room, so we're chatting to them as they're in the car park. We kind of do as much as possible, and then as soon as they come in the door, boom, they get a mask.
Okay.
And we've actually put up the barriers. We're putting up the barriers as we speak. So there's that plastic barrier, between the reception and them. But basically, they come in the back, and then we do our bit. And if we're generating aerosols, then it's the N95, and it's the whole, the disposable gown and the splash guard and the whole bit. It's like that's where we've gone to now.
Wow.
If you're not doing an aerosol generating procedure, then you don't necessarily need the PPE to the nth degree. But it's headed that way anyway, because what happens is people see that, and so I know dentists and they have staff, and they're like, nope, full precautions even for the exam, even though that's not the recommendation. But you can see where they're coming from. They're concerned, and if it's universal, it's universal, because now we kind of split universal to 2-tier, right? It's universal up to here, and now it's universal 2.0.
Yeah, I know. It reminds me of the situation back when I was working in a hospital facility. Um, if patients were known to be carriers of hepatitis C or B or
Yeah,
HIV, Dublin,
yeah,
so we had a population or patient pool in this particular facility um, that had a high preponderance of IV drug use, sort of an endemic thing, as it is in many cities. Dublin is no exception. And the patients who would be seen in the dental facility would have the staff who are working on them wearing what you're similar to what you're describing, in addition to their normal universal PPE.
hmm,
They would then wear another gown over their original gown. They'd be double gloved, and the instruments were put in different bags when they would be brought back to the sterilization. And it seemed completely pointless, and it seemed completely wrong, because the whole point of universal precautions is that it's universal.
yeah,
So while I think it's wonderful to put in extra measures to protect ourselves and the patient, and more
yeah,
important, the next patient who's in the chair
yeah.
and our staff, I think the epidemiologists will look back and will actually, once we learn more about this, going through the passage of time, we'll find out whether any of these measures are useful, or maybe they're useful, but epidemiologically, have they actually borne any fruit?
Yes, no, absolutely. Yeah, the line is aerosol generating, and even though you can generate aerosols with an examination, they figure, as soon as you're cutting into the tooth,
Yeah.
you're generating way more. But again, it's universally universal. Like,
Yeah.
yeah, and that is quite unique. And we've moved to no pre-op PAs. We do a small field cone beam because an extra oral
Yeah.
is always less invasive. And we've gone to, in some regards, accepting x-rays from outside offices, which used to be verboten in the past. It's like, no, we always have to take our own.
Okay.
Now we're a little more inclined to accept outside x-rays and such things. And yeah, it's crazy because we've gone that far, and you're right next door to us, and it's not to that extreme. And I'm wondering, with the epidemiologist 10 years from now, be saying, it didn't pay dividends for BC, or maybe it will. I'm not sure.
Yeah. Well, I suppose it's very hard always to prove. How do you prove negative? You
Yeah,
can identify, well, these are the cases that didn't happen because of the measures that Joel and his colleagues introduced, so
yeah.
individually to their offices, as opposed to that that slovenly Irish fella across the border.
Let me
But
fix your tooth.
yeah, it's I'm as dentists, we wash our hands between patients anyway, but now we're sort of doing that, and doing it really really concentrating on doing that again, to protect ourselves, protect the patient, protect the next patient.
Yeah.
But no, putting up plastic screens, I guess again, it depends on your floor plan. It would not be possible to do with my floor plan how it is, because there's no real, the reception is sort of semi-open.
Yeah. Yeah.
Um,
Oh, these are like the ones you would see in a convenience store. They're just, they basically sit on your desk.
yeah.
And they're there. It just.
No, I like it. I think that's a great idea.
Yeah.
Because I've asked my person at the front if I haven't told them they have to wear a mask, but I said, if you want to wear a mask, you can wear a mask. You don't need to have your face on for meeting people. Again, it's not mandated that non-clinical staff would wear a.
Are you placing more permanent fillings now because the referring offices are closed?
Yes, I am.
Yeah.
So some of my dentists will request temporary and come back, but now if they're not being seen until it'll be May 18th. That's where the executive order goes till, so it'll be at least till May 18th. So I'm placing them with the understanding that my referring docs will understand why I'm perhaps going against their express wishes in the past, because I want to make things stable. I don't want to have the patient need to call them or me to have a temporary filling,
Mm-hmm.
replaced or smoothed off. Anything we can do to minimize or to reduce their number of visits.
Has this influenced your 1 or 2 visit endo approach?
It has not, in the sense that I would still, I do 99% of my treatments in one visit anyway, in part because of some technology that I introduced to the office.
You can name the name. It's okay.
I wasn't sure. I didn't want to.
No. It's reality, right? And you're using the gentle wave?
Gentle wave procedure
Yeah.
is my go-to. And vital necrotic retreat cases, it's a single visit is entirely justifiable, and So again, just one more thing, potentially one more weapon we have in our arsenal that we can get a system very, very clean. Again, dental dam, of course, in place, so any aerosol that's generated is largely coming from a somewhat clean field.
Yeah.
Cleaner field than where we say, getting saliva and all sorts.
Do you get him to rinse with a mouthwash before the anesthetic, and are you rinsing the teeth underneath the rubber dam? I bought some of that povidone iodine.
Yeah, I read one of the reports saying that the
cheap
hydrogen peroxide rinse help lower, viral load in the mouth.
Yeah.
And maybe it does, but again, I don't really think there's been enough time or anything to assess these statements.
No.
Does that mean we shouldn't do them at all? I don't know. I'm not doing it. It's I clean the field with alcohol. We isolate just like normal. I want my field clean for my endo, and again, it's sort of a universal clean field. Clean enough. I don't know. Again, maybe from talking to you and hearing about the recommendations that are the almost enforced rules that are in place in BC and the measures you're taking, I'm beginning to rethink what I'm not doing or what I should be doing.
Well, it's last week, some of those things were just kind of thought about, and then this week it's like, oh no, we're definitely going to be doing it. But yeah, I'm almost seeing like no patients because and it's a different culture. The patients are not keen to come in, and they're all fine staying away. And I talked to Carl Woodmansey down in Texas, and it was the same thing. The general dentists were actually, now this is 2 weeks ago, which is in this COVID thing, a long time.
Yeah.
The patients were actually keen to come in for treatment because they had time and they have insurance.
Yeah.
And so they're actually knocking on the doors of the dentist to come in, and I was like, that is not the case here at all. Yeah. And with Washington State perhaps being a little more COVID hot than other parts of the US, you might see it a little bit different when you talk to colleagues back in Texas, chatting to them.
Yeah, I mean, they were a little bit slower not too slow. They were pretty quick in terms of, stay home or lockdown or, whatever the friendly term people are calling it. They were pretty quick. I was surprised that Texas acted as rapidly as it did in so many other states in that geographical area that are maybe more reluctant to do so. And I think that's going to be a big problem here. Because without a universally, people are losing their livelihoods and they're losing their life savings universally across the board. But if these rules are not everyone's not universally making the same sacrifices, it's be for no end.
Yeah.
Because we'll have all the financial loss with all the death if we don't act as one.
Yeah.
That's my big worry. That's why I'm going back to your description of the world will be a cleaner place in a week or 2 weeks. I would like to share your optimism, but perhaps in BC and other provinces that will indeed be the case. But I'm not convinced that'll be the case here.
Well, I might have just thrown that number a little too loosely around. Yeah, it's probably going to be a long haul for all of us.
Yeah.
And that suppression versus mitigation, if you suppress really well and you get that virus down, the problem is there might not be enough innate immunity to the virus, and then when you let off the rules again, you get a second wave.
Yeah.
Which is what we could be concerned about.
Yeah, and it's a very realistic concern too. And then where are we at then? Do we go back to restricting people to you have to be suffering X amount before you can have emergency dentistry? So.
Mm-hmm. So can you get your hands on supplies? Can you get disposable gowns? Can you get N95 masks? Because
N95 masks, I know.
It's so chronic here, the government's actually controlling the import. So anything that comes into the province, they're directing to the hospitals.
I have a friend who's also an endodontist here, and I think he has 2 or 3 colleagues have a larger office, and they got an order, I think, 100 N95s for their whole office. So that's, say, 3 endodontists and however many staff they have. And I think they were expensive. They were really expensive. So I don't know, but then at the same time you see, our frontline medical personnel who don't have any mask. 95 or other, nothing. So it's hard to, I don't know, it's hard to justify. I mean, if we're talking about trying to play our part, keeping people out of emergency rooms, but at the same time, I'm going to keep those. It's not to say that we don't have any PPE, but again, back to universal precautions has been good enough since I graduated in 2001. And I'm not, it's not that I wouldn't use one if I had them, but going out fishing for them when there's a dearth for the people who actually truly need them more than anyone. I don't know. I'm going to stick with my conventional procedure masks. Staff and, follow my universal precautions.
No, absolutely. And I'm a bit resistant. I have a limited supply, and a lot of dentists are being very magnanimous, and they're donating their supplies to the hospitals. And I'm thinking, we need them in dentistry, not necessarily me, but the oral surgeons who are setting up centers. As the weeks go by, when is the new stock coming in? And the government already controls the import now because they've brought it in, and so they're directing the new supply. So I'm thinking, well, anything new they're going to get anyway. And I could just see the hospital looking down their nose at me if I said, well, can I have some? We're saving lives here. A person can live without a tooth. But I'm trying to keep them from coming into the hospital. No. And I'm like, if you donate it, I hope you have a good stock, because I'm 2 weeks, maybe 3 weeks of work max. For the really powerful PPE stuff. And then the stuff from the good old days, like 2 months ago, I maybe have a little more.
That's it. Well, the procedural gowns and things like that, those are single-use, disposable, or you can wear one through the day? Or?
No, what happens is in the guidelines here, they say disposable. And you think, well, so we can't even have reusable. Like, you could even just say, okay, you know what, I'm just gonna go naked, throw that all in the wash, put on new clothes, and I even have a shower. I was showering between the patients, and I don all new clothes. You need a disposable gown. And you're talking to your staff. But
so if you're generating aerosol, you need a disposable gown for you and your assistant. And anyone else involved in patient care, or just chairside? Well,
maybe not the receptionist, because she's up front. But pretty much that's it. And we're kind of, no one in the waiting room. So it's disposable. And you're thinking, we're running out quick. And when you're in that situation too, is you really don't want to have that person who's meemawing about, well, do I really want the root canal? Do I not? You're like,
we've all donned our spacesuits and helmets here.
This thing's launching today, sweetheart. What is it? Forceps or files?
Absolutely. That's frustrating as we're seeing emergency patients and they're humming and hawing. It's like, this is not an emergency if you're humming and hawing. It's,
Are you phoning your patients yourself?
sometimes, because our hours are so reduced. So
Yes.
I'm having to field calls myself.
Yeah, I'm phoning the patients myself, and I don't know. I can, maybe I'm totally wrong, and I'm sure I'm going to make a mistake one of these days. But you can almost tell in the patient's voice if they have the uncontrolled pain.
Yeah.
Yeah, you know, and because I phoned one lady and she was, I don't know, in the middle of a joke and she was laughing, and I thought, okay, you know, I think I got this one with meds.
Yeah. That's I need to up my material, Joel. That's a really useful triage trick. You know, it's good actually.
Not many, yeah, you know, it's not many tricks, but you know, you try your best, and you can just tell if they're negotiating with you, like, oh, I'm worried about next week, or I'm worried about this. You're like, well, okay, well, because the ones that are in pain, it's like, I'll just come wait in your parking lot. I don't care. I'm not going to be doing anything else unless you help me.
Yeah.
Okay, that sounds bad.
Yeah. How are you doing with your staff? Have you had to sort of lay them off or furlough them? Or
Yes. So what it's done, there's a few of us, and we've kind of pooled our resources into one office that there's 4 of us that we share.
Right.
And so my office, well, officially I'm supposed to be on holidays right now, so that we just close that down. So my staff are holding to me to that. They're off. So there's no one really in my office.
Yeah.
And I'm working out of the other office, which actually is really good because we can pool our resources. We can bring everything together. So my office right now has been 3 weeks on fumes, you know, like just, and that's a concern. And yes, there's financial help, but the patients aren't banging down the door anyway.
Yeah.
You know, and so, it's a bizarre thing. And this is a bit of a different thing, but I know I was talking to a friend of mine, and he was saying, like, in Starbucks, like in China, when it was bad, 80% drop in revenue for your average Starbucks near Wuhan. Then things are returned to normal. It doesn't kick right back up to 80%. That's now the new normal. Now they're getting the little growth from there. Like, it's really taken a big chunk out of the market. And I think that's what we're going to end up with dentistry is
definitely.
And hygiene too, is people go, wait a minute, do I really want to go in to get a cleaning? And do I really want to do that? And the other thing too is, if we have to gown up and do all this stuff, I'm not, you going to do that for an occlusal?
What do you do with the extra cost per procedure? Is that, you just eat it, or you up your fee, or for all this extra PPE?
Yeah. Well, I'm right now inclined to up the fee, but because you're also seeing fewer patients.
Yeah.
So your costs have gone up, your billings have gone down, you know, and it's all this other rigmarole. You're like, whoa, okay. So dentistry's gone to where you can do some, I mean, endo's not really like that anyway, but it's slowing endo down, you know. And so it's a bit of a concern.
It's been once it was being sort of boom, just dropped to stop pretty much, like hit a brick wall. So as soon as the dental offices were shut down, as I said, a couple of emergencies here and there. But it's a big worry how things will be.
Yes.
In the short term and medium term.
Yes. Yeah, indeed. Well, this has been fantastic. I think we covered a lot of good ground. Any if you had to give 5 Gavin tips to the outside world, shut your door well before you do an interview.
Make sure you tell the interviewer to send you their hidden questions ahead of time. No, 5 tips. Jeez. I don't know. Just look at what's important to yourselves now. Just hug your kids a little tighter at night time.
Yeah.
And it's a scary world we live in right now.
It is.
I don't know. I don't have any tips. Just do what you can to stay healthy, and hopefully the numbers will be in our favor. I don't know. I'm not a very optimistic chap at the moment.
What was that site you were telling me about, the math one? That was quite interesting. Some people might like to see that, because it covers some really interesting stuff.
Yeah, actually, it's
right over my head.
Yeah, number file.
Number file. Yeah.
It's got a few million subscribers, and they cover all sorts of wonderful mathematical topics from, you know, old historical hypotheses or puzzles or riddles, if you will, to, you know, current day mathematical puzzles that you wouldn't even have to have any sort of training, just a paper and pencil. One was very good, the mouse in the lake puzzle, or the cat chasing the mouse in the lake. But they did have one recently, just the other day, on mathematical modeling. We've all heard about mathematical models are telling us this, and these exponential graphs. What the hell is an exponential graph? And it's at home. But they explain in this very short video, 10 minutes or so, how they create these mathematical models to model, in this case, a viral outbreak.
And they do speak to that specifically on the one you sent me. That was quite good.
Yeah, it's probably one of their more current ones. They do it via tele YouTubing. They have their expert in his house and the interviewer in his.
Yeah.
And, plugging in just 3 or 4, you know, simple variables, and they get the plot, the graph, the curve that we're all sick to death of. It's not, maybe choose better words.
Curve.
Well, sick of seeing, you know, flatten that curve, or you know, change the exponential curve to a logarithmic one, and things look happier.
I thought that was a Weight Watchers tagline.
I think anyone would, you know, with all the talk going on about curves and mathematical models, it's nice to be able to have a little bit of background to maybe speak that language, because I think it's very relevant for everyone, but particularly for healthcare professionals who may not be at the front line, but are maybe, you know, a few yards back from the cold face, getting the dust in their faces. It's important to know, you know, the numbers and a little bit about it, and play our part. But yeah, I'm always been a bit of a nerd when it comes to those sort of things. So it ticks all the boxes. But I'm sure there's plenty of your listeners who are similarly inclined. Number 5.
All 6 of them.
Number file.
I sent them all a Christmas card.
No, not file, like endo file.
Yeah. Well, when you first said it to me, like, oh, number file. Oh, okay. Yeah.
Check it out. You'll not be sorry you did. If the mathematical modeling one is a bit heavy for you, check out the cat chasing the mouse in the lake. You'll like that. Trust me.
All right. The cat chasing the mouse in Lake Washington.
There you go.
Well, that was fantastic, Evan. Thank you so much.
Hey, thanks very much for your talk today. It's been fun. Yeah.